Thank you so much for joining us today. I'm Dr. Catherine Taketa-Wong. Today I'll be explaining how the immune system affects autism. What I'd like you to take away from my talk today is that the immune system plays a major role in autism and that there are actually many ways to treat the various symptoms medically, and that their medical treatment is proven to help children with autism and their families live happier and healthier lives. Naturopathic medicine considers the entire body as a whole. So, for example, we understand how problems with the gut bacteria affect and many other things. That's why I focus treatment on the underlying medical disorders and conditions that give rise to symptoms. In fact, to successfully treat autism, we must include the medical aspect. Because the majority of children with autism have physical, medical problems underlying their behavior, my specialty is treating autism medically. Today, I'll be reviewing the problems that can occur with the immune system in children with autism and providing some brief examples of treatment. Let me start first in a nutshell of explaining what is the immune system, what does it do, and how can it possibly affect behavior. So to answer that question, our immune system is comprised of an interconnected biological network that includes white blood cells, organs, and tissues of the lymph system, such as the thymus, spleen, tonsils, lymph nodes, lymph vessels, and bone marrow. The job of the immune system is to take stock, to monitor and assess potential threats, and to fight off things that can make you sick. We also don't want the immune system to be overreacting to things that don't make us sick. I'll be explaining more about that as we go along. Going back to every aspect of our body being connected, nutrition is vitally important in maintaining a healthy immune system. Yet in the United States, fewer than 20% of conventional medical schools require any courses in nutrition. Of those, the typical offerings are fewer than 25 hours. That's 25 hours in 4 years. Let's remember that nutrition has bacteria in our gut that affect nearly every aspect of our body, including the immune system. Naturopathic doctors like myself typically receive 155 hours of training in nutrition in naturopathic medical school. We are trained to educate and guide patients to building their health from the inside. If you have a question that you would like to talk with me about, please call our office and schedule a free phone consultation. There's no charge because I don't take new patients without reviewing their situation first. We discuss your health concerns and come up with a plan to help you improve. All of contact information is on our Facebook page, or you can click on the link in the post in this video. As I mentioned, I approach treatment comprehensively, and so this includes looking at all aspects of the person's health, which is why my patient visits are 1 hour, not just 10 or 15 minutes. It's a partnership between me and my patients. We are talking today about autism and the immune system, which is able to coexist with the millions of microbes we share our body with. But if an invader is deemed a threat, the immune system has a specific function: destroy the threat while doing as little collateral damage as possible. This response from the immune system is what we call inflammation. Inflammation can be a kind of molecular warfare. Killer cells and molecules flood the zone in order to eliminate a pathogen from the body. The area of infection can look kind of like a war zone, with good soldiers rushing in to assess the problem, attack it, clean up the area, and rebuild using new tissue. For most of us, inflammation could feel like a stuffy nose, a sore throat, a headache, a stomach ache, a fever, or fatigue. The symptoms of an immune response feel junk, but we have to suffer a little to keep the rest of our body healthy over the long term. With autism, it's a different story. Research has found that there are often many types of imbalances in the immune system in people with autism. For example, the immune system may be attacking things it's not supposed to attack, like certain foods. This is what is happening when people have food allergies. Our immune system is actually attacking that food. Or it could be that the immune system is attacking the person's own body, which is never a good thing. In addition, the immune system may not be able to effectively fight off infections. That's why many people with autism suffer from chronic infections. That can include things like strep throat and skin infections, but also intestinal infections from harmful bacteria, yeast, parasites, and viruses. We often find that these medical conditions in autism can cause or contribute to the symptoms and behaviors that are labeled autistic. For example, a child may be rocking back and forth over and over and over. I have seen firsthand how this can often be related to a yeast infection, because when I treat the infection, we see the behavior improving. I've also treated children whose immune system was attacking certain foods, which in turn caused things like abdominal pain. And that pain was causing them to be aggressive and to engage in self-injurious behavior. These children also had a difficult time concentrating in school because they were always so distracted by their pain. And so when they're in school or when they're in therapy, it can be really hard for the therapists to be able to get them to focus and to be able to teach them the things that they need to be able to learn. I have treated child after child with autism. And what I've seen is that when we take these allergy-causing foods out of their diet, the parents, teachers, and therapists have all noted that the child's aggression diminished significantly, and their self-injurious behavior decreased, their language improved, and their overall awareness increased. One parent told me that it was like their child's brain woke up, and then they started responding to things and noticing things that they hadn't. Can be to foods or environmental allergens like pollen or dust mites. Now, in both allergies and sensitivities, what can happen is that the immune system is attacking things it's not supposed to. The difference is the type of antibody produced and the intensity of the reaction. But in both cases, the immune system is making antibodies that attack the food or the environmental allergen that people are reacting to. Here is one quick example of treatment. Once laboratory testing has confirmed the existence of food or environmental allergies or sensitivities, I work with the family so they can learn to avoid the problem-causing foods and focus on the ones that are beneficial and or to remove and then avoid the environmental allergens. In addition, I often prescribe natural remedies like herbs and nutritional supplements to help rebalance their immune system and help to decrease their immune system from attacking those foods. As a side note, if you are looking to purchase supplements that support the immune system, they should be ones that are laboratory tested for high quality. I invite you to check out our online supplement store. It's the only one with trusted products, a 20% discount, and where 100% of the proceeds go to supporting treatment for families with autism. It's at drtaketa-wong.com. That's drtaketa-wong.com. And you'll find the link in the post with this video. We'll get back to autism and the immune system in just a moment, but before we go on, I wanted to pause to remind those of us who are just joining us that we offer a no-charge phone consultation, so you can talk with me personally about any health concerns you may have and about how to feel empowered with easy. All of the contact information is on our Facebook page. You can call or text number and just ask for a free 30-minute phone consultation. Children with autism often struggle with chronic infections or ongoing infections. This can include yeast, fungal, viral, bacterial, and parasitic infections. These ongoing or chronic infections can cause many different symptoms that may include abdominal pain, diarrhea, headaches, skin infections, and sore throat, among many others. Many children with autism are unable to communicate and tell their parents, "My head hurts," or "My tummy hurts," so it comes out in their behavior. I've seen many children where they start hitting their head. They may be hitting it really, really hard because they feel so uncomfortable in their body. Or they might press their belly constantly against a chair or a sofa. Aggressive as an outlet for their pain. The behaviors are often labeled as autistic, but I've seen so many children whose so-called autistic behaviors improve, sometimes dramatically, with medical treatment. Moving on, research has found that many children with autism have autoimmune problems. This means that their immune system is attacking certain parts of their own body. One such problem is folate receptor antibodies, which is when the immune system is making a protein that attacks a certain part of the brain. That means that folate, which is essential for normal brain development and function, is blocked from getting into the brain. It's also important to note that 75% of children with autism have folate receptor antibodies. Let me say that again. 75% of children with autism have folate receptor antibodies that prevent folate from getting into their brain. And how does that show up? This can affect their language, it can affect their awareness, their brain function, their ability to talk, read, their social skills. It can affect their behavior, and many other things. One additional problem with the folate receptor antibodies is that they can cause inflammation in the brain, which is not life-threatening type of inflammation like meningitis, but it interferes with the brain's ability to function normally. So again, these problems with folate receptor antibodies can result in the child having delayed language development, lack of awareness or language. This has also been associated with seizures and many other symptoms. There are also other types of antibodies that have been found to attack the brain in children with autism. And in addition, other autoimmune conditions are more common in children with autism than in neurotypical children. Here's another quick treatment note. Typically, if laboratory testing confirms that a child has folate receptor antibodies, I will prescribe something called folinic acid. This is a form of folate that can make it past the blocks from the antibodies and can help to restore normal brain function. In addition, there are certain vitamins and supplements that will benefit the child's condition. I've seen amazing improvement in children with autism once their issues with the folate receptor antibodies have been resolved. Next, I want to tell you about a condition called PANS and Pandas. Now, these aren't like pots and pans. Pandas doesn't refer to those incredibly cute bamboo-eating mammals. PANS is an acronym, PANS, that stands for Pediatric Acute Onset Neuropsychiatric Syndrome. Again, that's Pediatric Acute Onset Neuropsychiatric Syndrome. PANDAS, or PANDAS, stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Streptococcal Infections. And that's a mouthful, so that's why it's called PANDAS. Now, with both PANS and PANDAS, there is something that triggers the immune system, and it goes haywire, and then the body starts making antibodies that actually attack the person's own brain. In PANDAS, the trigger is a strep infection. In PANS, it can be other types of bacteria, not just strep, but also viral infections, yeast or mold. Also, heavy metals can be a culprit. And basically what we see in both PANS and PANDAS is that we often see a sudden onset or sudden worsening of obsessive compulsive behavior. The child may also have a sudden loss of appetite along with personality changes, acting in ways that are very unusual for the child. They may also have aggression, anxiety, depression, new fears, trouble with sleeping, and bedwetting. As a treatment note, since these conditions are related to infections, I will prescribe either pharmaceuticals or natural medicines to help to kill the infection, and also recommend medicines that are helping to try to rebalance the immune system. And I use both as a part of this overall care and approach to treatment for PANS and PANDAS. Now, the last thing that I want to bring up in the context of the immune system is something called maternal immune activation. This is where the mother is actually making antibodies that attack the baby's brain while the baby is still inside of the mother. There was a study with 246 children with autism whose mothers were tested. The control group had 149 children without autism. The study revealed that 23% of mothers with those children who had autism had antibodies that were attacking the child's brain. By contrast, only 1% of the control group children of the control group mothers had antibodies that were attacking the child's brain. What is happening here is that the antibodies that are being made by the mother's body are attacking fetal brain tissue, and it is never normal to have those antibodies in the blood. At this time, medical science doesn't completely know why mothers make them, but research has found that if the mother has an autoimmune condition, she is more likely to have a child with autism. Or if the mother has other issues in her immune system in general, again, a greater risk for having a child with autism. In addition, it's generally recognized that if the mother has high levels of inflammation, it creates a higher risk for making antibodies that may attack the baby's brain. What I'd like you to take away from our talk today is that the immune system plays a major role in autism, and that there are many ways to treat the various symptoms medically, and that medical treatment has been shown to help children with autism and their families live happier, healthier lives. I trust that our discussion about autism and the immune system has been useful for you. Does your doctor take the time to educate you like we're doing here today? If not, you are welcome to talk with me personally about any health concerns that you may have so that you too can feel empowered with your health. To do so, just call or text our office to schedule a free phone consultation with me. There's no charge because I don't take patients without talking to them first. I always want to make sure that what I do fits their needs. You'll find all of the contact information on our Facebook page, and you can also click on the link in the post with this video. Also, please be sure to check out our online supplement store. It is the only one with independent third-party testing to ensure that you have high-quality, trusted products. We also provide a 20% discount off of the regular retail prices, and 100% of the proceeds go to supporting treatment for families with autism. It's at drtaketa-wong.com. That's drtaketa-wong.com, and you'll find the link in the post with this video. Mahalo, thank you for joining us, and we look forward to seeing you in another 2 weeks. Aloha.